This is the most serious situation we've ever been in, ever, since the beginning of this pandemic.
A visibly worried premier issued a warning today as the COVID-19 case count ballooned to a new record, saying if public health guidelines continue to be ignored, the consequences will be more dire.
The shutdown won't end at the end of January, and we will have to look at more extreme measures.
Doug Ford says more measures are coming, but they aren't being explained or implemented today, despite Ford saying the situation is desperate. The premier says new modeling data is coming next Tuesday. That will be a real wake-up call for everyone.
You'll fall off your chair.
The Ford government says many people continue to break the rules, driving further spread of the virus, and it is pleading with people to follow guidelines.
They're still gathering outside of family groups.
We don't want to scare people, but on the other hand, I think there's too much complacency.
And frankly, everybody that I speak to within the hospital is frustrated.
Working at a relentless pace, infectious disease doctor Dale Kalina from Burlington's Joseph Brant Hospital is seeing that complacency firsthand. He and his team keep seeing COVID patients who've been engaging in risky behaviors.
We keep seeing people who have been at parties, who have been gathering, who've had relatives coming over to their house who have been positive and spreading the infection.
He says people need to take responsibility.
There are people who, as I've said, are dying as a result of you having a party.
But believes Ontario needs stronger lockdown measures and says a somewhat soft tone from our leaders has contributed to a climate where people continue to travel and gather and don't appear to understand the gravity of the situation.
There has been a distinct lack of dealing with this crisis like it is a crisis throughout this second wave.
I don't want to wait till Tuesday to fall off my chair.
Official opposition leader Andrea Horvath says more is needed than another plea for people to follow health guidelines, calling for more measures and that new modeling data to be released immediately, and for Ford to get new medical advisors, including a new chief medical officer of health.
And I would say it's time for better advisors. Why is he once again not getting the urgency of where we are today?
Meantime, Dr. Kalina says Ontario doesn't need new modeling data to show how serious things are.
The numbers that we have right now are not sustainable. They are unsafe, and like Dr. Yaffe said earlier today, they're scary.
Right now, Joseph Brant Hospital behind me is caring for 14 confirmed COVID-19 patients. But with the virus continuing to spread throughout our community, all hospitals can expect more as this COVID-19 pandemic continues to threaten the healthcare system.